Hello, everybody. I'm Dr. Shashank Joshi. You are watching the 513th non-stop edition of Dr. KK's Med Talks. And let's have the headlines for the day. So we know today it is a historic day. And the historic day is that we are recording one of the lowest number of active cases in India. And the total number of cases diagnosed per day has gone down to only 6,000. And there are more than 95,000 active cases, which is the lowest caseload since the pandemic started of March 2020. The recovery rate is one of the highest at 98.36%. This Omicron scare is very much around. 23 cases are currently there in India. 10 cases are in Maharashtra. We know that there has been a report from the Swane complex in Pretoria, the global ground zero for Omicron outbreak, that the variant is causing less severe disease. But it is too soon to draw conclusions. Out of the 42 people who were hospitalized on 2nd of December, 29 were not on oxygen dependent. So obviously, most of the admissions were incidental admissions. WHO today, of course, recommended that there is no use of plasma therapy. Currently, WHO says world malaria is 14 million more cases in 2020 compared to 2019 and 69,000 more deaths. And two-thirds of the additional deaths were linked to disruption in care of malaria prevention and diagnosis due to the COVID pandemic. But today's topic is predominantly Omicron, the Indian perspective. And you know that Omicron is a sporadic travel-related hotspot in India. And it is something which we need to be mindful of and careful of. And we have joined with us by my brother, Dr. Rahul Pandit, on the Jopa show. We all know Dr. Rahul Pandit is one of the best, foremost intensivists in the country. He is a senior vice president of the Indian Society for Critical Care Medicine. He has a dual appointment. He's an academic faculty at Mumbai as well as in Australia. He's very well trained. He's a chief of critical care at Fortis Group, and he's involved with both national and state task force for COVID management. And today, before Dr. Rahul Pandit, I asked him a couple of questions on COVID and his impressions. We both were in the meeting of the WHO, and he will give you the briefing of the WHO meeting from the clinicians of South Africa. But one thing is there that there are 4 questions which come in everybody's mind on Omicron. Number one, on the microbiology, on the molecular front, the mutations are 50. So people say, oh my God, so many mutations, so scary. So first thing is that in South Africa, there is community transmission. Rest of the world, UK, probably there is community transmission. Rest of the world, the community transmission may or may not be there. So we don't know. Secondly, more than 17,000 people have come to South Africa now in the last couple of weeks. So obviously, we need to be vigilant. We need to do our track and trace very well. We have to congratulate Government of India and Government of Maharashtra and all other state governments for actively handling this Omicron variant issues. We have genomic labs in place. We have gene deletion mutations in place. So what is Omicron? Number one, will it replace Delta? Answer is we don't know. Is it more transmissible than Delta? Probably yes. Will it cause more severe Delta disease than Delta? Probably not. Will it cause more deaths than Delta? Probably not. But this is very early data. Okay. Will it cause immune escape? Will it cause reinfection? Maybe. And is it really transmissible? More transmissible. In South Africa, Pretoria prevents? Maybe. But rest of the world, we don't know. So actually, there are more question marks and less answers. And right now, there are 3 types of evidences. Number one is what is published in published literature. Nothing is published in published literature. Number 2 is anecdotal evidence like hearsay. Then, of course, there is informed speculation. And then there is wild speculation. So don't get panicky at all. We need to be cautious, number 1. Number 2, probably whatever we are talking today is based on anecdotal evidence, coordination and discussion and dialogue with South African doctors, and on informed speculation. So don't get misled. And finally, behave responsibly, mask appropriately and double mask, which Dr. Rahul and me have been propagating, and fundamentally vaccinate totally. So having said that, my first insights will come from Professor Pandit today. He will give us, he is just a half an hour back. the WHO expert group for clinicians met, and the clinical people from South Africa spoke. He is going to give us the first insights on that. So let us hear that from Dr. Rahul Pandit.
Good evening, sir, and thank you very much for having me on the show. Professor Shashank Joshi, Padma Shri Award recipient, famous endocrinologist, and he is also on the World Diabetic Association as the president of that, IDF president. And obviously, he is the leading member of the Maharashtra COVID Task Force. He's the voice of Maharashtra COVID Task Force. So we both were there on this WHO meeting not long ago, and two people spoke. One was Dr. Valsa, and the other was Dr. Fardeen, and both of them gave insights in adult as well as pediatric population. So some of the big highlights for me were: one, the patients who were admitted in the adult hospitals or the adult population, majority of them, almost 75% of them, did not require oxygen. Almost 65% of them were incidental COVID patients. That means they have come for some surgery and they were found to have COVID positive, and that's why they were admitted. There were patients who were admitted in the intensive care. Of the two who were admitted in intensive care, one was admitted because of cerebral bleed and was found to be COVID positive, so not predominantly COVID pneumonia. But the second patient did have a significant amount of COVID pneumonia, bilateral, and was requiring non-invasive ventilation. So they are getting some patients with Omicron who have a potential to worsen. But here is the caveat: all the patients who were sick and required admission because of COVID-19 in the hospital were unvaccinated. None of the patients who were vaccinated actually required admission to the hospital. And I specifically asked them which vaccines do they take. And the healthcare workers were given Johnson and Johnson in South Africa, and the rest of the population has been given the mRNA vaccine from Pfizer. But only 30% of the population has been vaccinated. So just like any other big country, India is in a better situation. We are almost 50% population is vaccinated who are eligible to take a vaccine. I think that's very important thing to do. Another thing which is very, very concerning is that almost 30% of the people were young, below 50 years of age, and almost 20% of the people who were positive were children below 10 years of age. So out of 2,300 samples, almost 490 patients were children. Majority of them did not require admission. Majority of them did not require hospitalization. None of them reported a multisystemic inflammatory syndrome, which we know as MIS in children. However, it is a concern that we have got this sizable population which is positive. Why does it make a difference to us? We probably know that children don't get enough response from COVID in terms of their um, severity of illness because of the natural protection which they have. But my concern is that these children are at home, they are with their parents who may be having immunocompromised states, diabetes, hypertension, maybe a cancer survivor, maybe a cancer patient, grandparents who are always fond of kids or of grandkids, who play with them, and they may be a close contact, and we may actually have a transmission. So I think we need to have a very strong basis here to understand that children could be one of the reasons why the disease may actually spread, if at all it comes across to the country. And I think these were the main highlights of that meeting. So my takeaway from that meeting was, it's still early days. We need to wait for a couple of weeks or maybe 3 weeks or 4 weeks to understand whether now unvaccinated people are the ones who are still getting admitted, or we are getting elderly who are vaccinated or immunocompromised who are vaccinated who are now coming into the hospital. I think that part needs to be still answered well. So my submission here is, please, please, please go ahead and take your vaccine. Don't have any thoughts around that. Every vaccine which is made available in India is very, very effective, and it seems that even with Omicron we will have a very good protection, at least looking at the data which has come out from South Africa on the WHO platform. So I can vouch for the authenticity of the data. They were not just giving out a news report. These were doctors working on ground people in the hospital. They have given out this data. So My plea to everyone, please vaccinate. And of course, as Professor Joshi mentioned, double masking for everyone and N95 mask for healthcare worker. So, sir, I think we've got one first question from Nandalal Sharda ji. Foreigners get checked up before flight, again on landing. He's rechecked, even found negative at both ends. Why is they asked? Why are they being asked for quarantine? I think that's a basic question which many people are asking. It may not be related to foreigner, but it could be related to a lot of family members who are returning from abroad right now. We've all got some family members coming down for the holiday season, who we know, or maybe who somebody we know has got some family coming in. So I just want this question to be answered from you, sir, very effectively. That why is quarantine needed?
So remember that the incubation period of SARS-CoV-2 is usually 6 to 7 days. In the Delta variant, it got shortened to 4 days. And maybe the Omicron, it may be shortened to even lesser than 2 days. So ideally, we are doing an RT-PCR test 72 hours before departure. US has changed the guidance and they have mandated you to do it 24 hours before departure. UK has said do it 48 hours before departure. So the incubation period is anywhere there. Then you know that's only 70% of the time the RT-PCR is accurate. So 30% of the time you may be harboring the virus, but you may be tested negative. So the reason of frequent testing is you might have picked up the virus on the aircraft. It will take you 3 to 5 days to develop the disease. And therefore, you have to get, you know what is the rule in Hong Kong? Throughout the last 20 months, if you come from any part of planet Earth and you land into Hong Kong airport, you have to test before you depart. You have to test on arrival. You get institutional quarantine for 14 days. And after that, you get home quarantine for 7 days. And you keep testing it because the total COVID timetable is 21 days. But in India, the government of India said at least 7 days of home quarantine. And if in that 7 days there are no symptoms developed and you test negative, you are good. So your likelihood of being risk to yourself, your life, your near and dear ones, as well as people at large is less. So that is the reason there is a quarantine put in place, and we expect people to follow that quarantine. So Nandanji, your question is very correct. It is nothing to do with just foreigner or no foreigner, and I think that is very important. And Pradeep Sarvaya ji is also asking a question: ki, is vaccination should be made compulsory? That's what I'm going to ask Dr. Rahul. Dr. Rahul, should this vaccination be made compulsory? Because you made this very compelling point that it is really the vaccination which is the key driver. And even you just talked very nicely about the South African doctors. So really that's very, very important. And then I'm going to take one more question, Dr. Rahul. Vishal Bhure is asking, if a person never had COVID in the past, he got Omicron COVID, is there any way that he and she can get Delta or any other variant in the future? So, or somebody got Delta. Okay.
Understood.
Do you feel that you are safe?
So I think let's answer the question from Pradeep Sarvaya ji first. That should vaccines be made compulsory? I just got some news trickling in on the Twitter. I don't know the authenticity of that. I think I'll have to check it up. That Germany has made it now compulsory that unless you are vaccinated, you will not get employment. So I think in a democratic country, making things compulsory becomes a problem, because it's ultimately my body, my choice, and most people would have their own opinion about it. But incentivizing, like this, what Germany has done, that you get yourself vaccinated, you will be eligible for employment. I think that incentivizing makes a big difference. So we should probably incentivize people. Maybe small things can be changed. Maybe if they have vaccine certificate, maybe they'll get 10% discount on a train ticket or a bus pass or something like that. Maybe employment will be preferred for them. Maybe you could have several things which the government schemes can actually implement as a part of it. So my belief is that vaccination should be made extensively available to everyone. Another thing, Pradeep ji, is that we feel that vaccines are available easily. I have doubt about the remote areas. And me and Professor Joshi, both of us visit this place called as Karjat, which is just an hour and a half out of Mumbai. And every time I go there, I find that people have very little knowledge about vaccine. So, I think it should be the way it should be is like an election. When you put up an election booth, Most people have to travel a very short distance to go and cast their vote. Similarly, the vaccine should be, if not door to door available, should actually be available very close to their house so that they don't have to walk more than, say, half a kilometer or so to get themselves vaccinated. I think these are some of the things which we can do to improve the vaccination. What was the second question? The second question was about Delta variant. So I think this is a very interesting question, Vishalji. We need to understand that any disease because of any variant of COVID-19 will give you some amount of immunity. And that immunity will differ from person to person depending on your basic immune response to the disease. So most people will develop antibodies which will be protective. People who are on immunosuppressive therapy may not develop antibodies which will last long. But still, nevertheless, the process of developing antibodies is much stronger when you get a disease rather than a vaccine as such. But it does not confer you a lifelong immunity against any other variant or the same variant also. So forget about Delta. If you get a Delta or Omicron now, you have a 2% chance, which is what we call as 2% breakthrough infection seen in vaccinated population, because that's the only population which we are actually able to study who have got a breakthrough infection, which is the population where we know that we have given them antibodies. So there's a 2% chance right now from the data available that there could be a breakthrough infection, and you could still have the Delta variant, you could still have the Omicron variant, or any other new variant which comes across. So the message here again comes back to the same thing what me and Professor Joshi say: mask up and get your vaccine shot if you have not done it still now. So I think another we've been all debating on this on TV, and we've all been having our own thoughts on this. More or less we concur on each other's thoughts, but Surender Bansalji is asking about vaccination in children and booster dose. I think people need to understand an additional dose, a booster dose, and a children vaccination. I think these are three different compartmentalized populations.
The first thing is there are different types of vaccines. The current COVID vaccines are early generation vaccines. These early generation vaccines prevent you from dying and severe disease, but they don't prevent you from getting COVID. So you can still get asymptomatic or mild COVID. So that is the first principle. So we are in global search for getting neutralizing vaccines or sterilizing vaccines, which may be from nasal route or injectable route, or subunit vaccines, which is work in progress. That's the first thing. Secondly, in India, we have predominantly Covishield, a little bit of Covaxin, rest of it is Zydus and Sputnik. Well, rest of the world has a lot of mRNA platform like a Moderna and a Pfizer, with a little bit of Astra, a little bit of Johnson & Johnson, which is adenovector. So the platform on which the vaccines are made is different. The third thing is that the Moderna, Pfizer, and the adenovector Johnson and Astra, they have recommended a mix and match, and they have recommended boosters, but the data shows that all these vaccines only were useful one and second dose for 3 to 6 months only. So the data was pretty disappointing. So don't get carried away by global recommendations. We need to generate Indian data, Indian science, and Indian guidelines. So the regulators are thinking that we had a large second wave. A large population had seropositivity of almost 90% in urban metros like Delhi and Mumbai. And that was natural infection. And if you have got two vaccines, you are good because you have actually the natural infection was a booster. Same thing held true for children, which is why they have deferred, and there has been a disagreement with experts that whether there should be an additional dose, whether there should be a booster dose, or whether there should be a children's dose. So if you ask me if vaccines are sufficiently available, the first thing is we must vaccinate as many people as possible, as quickly as possible, to people who have not got a single vaccine. Because first thing is we want to save every life, every Indian matters. Second is give the second dose if it is delayed. And if we have then a stock, which probably we have, then in this following hierarchy, we should administer the extra dose. First is extra dose for people who are moderately to severely immunocompromised. Second, and that is below 6 months also it is okay. Second is to administer the booster dose, which has to be administered to people after 6 months who are in the healthcare worker space like us, in the frontline worker space, people who have comorbidities and elderly. And finally, pediatric vaccinations. First, to be prioritized for people above 15 and 12, and then eventually to everybody. See, remember, COVID cannot be eradicated till you don't vaccinate every person on planet Earth with adequate vaccination. And currently, we know adequate vaccination probably includes third dose, probably after 6 months, and or a natural infection. So if you have got natural COVID with 2 doses, you are likely to be safe in absence of Omicron, and Omicron is likely to be mild. But all these are ifs and buts. This is informed speculation. So from a booster standpoint, third dose standpoint, children's standpoint, should it be done? Yes. Are we ready for it? Probably not. Do we have generated adequate data on Indian population? Possibly not. Is the Indian population having sufficient antibodies and T cell, and does it have hybrid immunity? Probably yes. So based on all these considerations, the government of India in their wisdom, which is centralized, the NTAGI body headed by Dr. Arora, will debate this, deliberate this, and take a reasonable scientific consensus and will implement the policy in the future. We all feel that it should be done. There is no harm simultaneously doing it. If the vaccine supply is available, I personally feel it should be done. If there is sufficient supply available, of course, our primary objective is very different. So, Dr. Rahul, I don't know what are your takes on this, and then probably we'll close down. We'll take one or two more questions and we'll close down. I have only one question for you, which Vishal Bharde is asking.
My take is exactly the same as what you said, sir. I have completely concurred with what you said. Nothing new to add. Nothing more to add. Sorry.
So I'm going to do a quick rapid fire for you. Okay.
Yeah.
First is that how long can the monoclonal antibody protection last?
So approximately 60 to 90 days. But that's not why it should be used. It is not a prevention. It is a treatment still.
Our popular Mahim family doctor, Dr. Nanda Shimpi, asked that question. Vishal Bharde is asking the question: is povidone iodine gargle effective along with a mask?
So there is no data to protect or suggest that povidone iodine mask gargle is effective, but mask is definitely effective. So if you're going to use povidone iodine along with that once in a day or twice in a day, it's not going to be harmful to you. But there is no data to actually support that.
And the final thing is, Bimla Kapoor is asking, above 90 people are very reluctant to get the vaccine. And they are unable to go to the center. So, what should be done there?
So I can tell you, I can share with you that me, Professor Joshi and Professor Oak, all three of us had actually been called and discussed about home vaccination by the highest authority in the states. And following that, the court had even actually requested the state to vaccinate people. And there was a home-to-home, door-to-door vaccination drive which was undertaken in Mumbai. If I'm correct, 2,000 plus people were vaccinated. Professor Joshi, you please correct me if I'm wrong with the numbers. 2,000 plus people were vaccinated from home to home. And I think you should go to your local ward office if you have people who are above 90 and request them to come home and vaccinate. This definitely can be done. There is a precedence to that. So, Professor Joshi, I think one last question, just last question from the viewer, and we can close. Is Omicron more deadly than Delta? I think this should be the last question for the day.
So the answer is, the current suggestions do not suggest that it is more deadly. Microbiologically and virologically, it appears to be more deadly, but the clinical outcomes in the last 3 to 4 weeks, and Amit was asking this question, what is the duration of illness of people who have got Omicron in South Africa? It's only 2 to 3 weeks. So it's early days on Omicron. So only time will tell us whether it will be deadly or not. So I think let us keep our fingers crossed. Let us hope, wish and pray that Omicron probably is less severe and less mild and is evolutionarily the less virulent virus compared to the Delta strain. So with that, Dr. Rahul Pandit, thank you so much. And again, once again, I thank all our viewers, and we have once more the Dr. KK's Med Talks coming up very soon, and that will be the 514th show tomorrow. Thank you so much.
Thank you, sir. Bye-bye. Thank you, everyone.